So hello everyone, my name is Mohamed Mabrouk, fourth course medical student of Kazakh National Medical University. My research work revolving the risk factors for mortality in low birth weight infants with intraventricular hemorrhage. So moving on to the prevalence of such a disease, we find that 10% of current population of preterm birth infants are preterm birth infants. 0.6 are extreme preterm birth infants, but when you have an IVH accompanying this preterm, the statistic goes up significantly, going up to 20%. And in extreme preterm birth, it's 45%. So what is IVH? What is intraventricular hemorrhage? It's a bleeding that happens into the brain's ventricular system. And for us as future doctors, the IVH remains a significant challenge in the neonatal intensive care unit, because despite the advances that we have in neonatal care units, the IVH mortality remains high. Speaking of what did I use in my study, first of all, my aim in this study was to identify by prognostic factors and help early diagnosis, because when I have early diagnosis, I can have treatment, personalized treatment. Our study design was a retrospective case control study. We had 228 premature newborns with IVH. Our inclusion criteria that I used was gestational age less than 32 weeks, birth weight less than 1,500 grams. And of course, it had to be admitted to the ICU of the Center of Prenatology and Pediatric Cardiac Surgery in Almaty between 2021 and 2023. For the statistical analysis, I used an IBM SPSS calculator for the odds ratio. And that's all. I use that because I need to identify the factors associated with the increased mortality risk. For my data analysis, I needed a binary logistic regression model, which will be done by ROC analysis, and having two outcome variables. First, a mortality independent variables, and I will have a clinical factor variables. So moving on to the results, what did I find when I did a force plot of the odds ratio? We found that on the APGAR score, at 1 minute, from 1 to 3 points, we find that it is 4.9. First blood group, it was 2.4. At alkalases, it was 3.2. DIC, which was the highest, it was 5. And NEC was 4.6. We find that each one I have to speak about separately. So APGAR scoring, what is APGAR scoring? APGAR, it's like a Bartle index for Parkinson's disease, for example. We have to assess an infant's health 1 minute and 5 minutes after he was born. So we have to evaluate heart rate, respiratory effort, muscle tone, reflex response, and skin color. Also, later on, when we evaluate this stuff, we'll find if we have low scores, we will have poor physiological function of this, which means that we need immediate medical attention for this patient. So what is the relation we have with morbidity? We find that when APGAR scores are like very low, we find that there is higher rate of complications such as hypoxia, respiratory distress syndrome, and neurological issues. For our long-term outcomes, we find that they are linked to increased risk of long-term problems in development. Going on to our blood groups, which blood group did I have that was associated? We find that blood O type group was the most associated one. Why? Because it has lower levels of factor von Willebrand and also factor number 8 in the blood. What does it affect on us? It affects because when you have lower levels of clotting factors, we find that reduced clotting capacity, which will then increase the risk of IVH. Because why? The vessels can bleed more easily, which then making more stable blood clots, and what they can increase the risk of bleeding going to the brain. When we understand this predisposition, it allows us people who work in the clinic to potentially apply targeted preventive measures to reduce the likelihood of IVH in type O infants. Moving on to the next one, we have acetylalases, which mainly characterized by a surfactant deficiency. This surfactant is helping in reducing the surface tension in the lungs, which keeps the alveoli open. When you don't have enough of this, it makes it hard for the lungs to expand, which then will decrease oxygen, increase the carbon dioxide in the blood, which will also impair the removal of the carbon dioxide, which will often lead to lung injury and inflammation. And if we go to the most deadly risk factor that we found, which is DIC, we find that disseminated intravascular coagulation First of all, it starts by triggers like infection or hypoxia, and then the coagulation system becomes activated, which helps in microclotting, small clots throughout the bloodstream. And these microclots, they take factors and platelets together. When these depleted coagulation components are depleted, it makes a bleeding uncontrollable, which will increase the hemorrhage risk, increasing the IVH risk. Last but not least, the necrotizing into enterocolitis, which happens because an intestinal inflammation disturbing the intestinal barrier. Then it will release inflammatory mediators also into the bloodstream. And when we have inflammatory mediators into the bloodstream, the permeability of these blood vessels in the brain mostly will make IVH more likely, which will make associated conditions such as thrombocytopenia, as mentioned before in the conference earlier on, and sepsis will elevate the IVH risk. So when I did a ROC analysis and we found out that, as I spoke about earlier, DIC, as you can see here, it is 0.7, which is the highest, which is like a very good result, which meaning when someone asks me, what is AUC, it's like, it helps you differentiate between a yes or a no for the risk factors. So when I have a DIC at a 0.7, almost to a, it's like a very good result, which means if a patient comes with correlates, with DIC, it means he has a higher chance of IVH related mortality and also death and some other. And the lowest was related to the blood group. So moving on and concluding, summarizing whatever I said, it means that all this mortality rates persist among low birth term infants and that will come with IVH. And this makes an importance for us because we have to monitor and proactive management of these conditions later on. And if we can diagnose them earlier, we can have a personalized treatment approach, which will help us have a better survival outcomes. So next, I want to thank the team members that were coming on the project, Dr. Araylam, our associate professor, me, personally, the undergraduate student researcher, Mohamed Mabrouk, my older sister, Minnatullah, our biotechnologist, and Dr. Dinara from the neonatologist clinic, the head of the intensive care unit. Thank you, everyone. Any questions?
Thank you. That was an impressive presentation. Are there any questions or any comments for this?
Maybe just one comment. Can I see the main slide that the result show the result that you show out the odds ratios of each risk factor?
Which one?
Can you show again the slide that present odds ratio of each risk factor?
Yes, the fourth plot.
Yes, that's just my comment that this is the very important slide of your result. Then I think you show this slide for a very brief time. So I would like to see this more. And also to make the conclusion, I'm not sure this is like a multivariate or univariate analysis. Because
it is a multivariate analysis.
Okay.
Because
thanks.
it helps us get the whole perspective, actually, of the study. Okay. And we do not stop here, actually. This is, concluding from this is not where I stop, because we have a big project. It aims to identify not just these risk factors, but also microbiological, immunological, and genetical factors of bronchopulmonary dysplasia. Because we need to make this is just like a small part, a small step. We need to make a step. So not a step, we need to make a conclusion later on and further research so we can make like an index to predict the disease before it happens, not just to know that there is this risk factor that's going to happen. No, we want to predict it so we can prevent this disease before it happens, and plus the treatment approach, of course.
Okay, thank you. Just a comment that this is an important result of your slide, so you should keep it, stay and explain more. Okay, thank you.
So just following the similar comment that she just said, you also said that this is the OR with like confidential intervals, but I did not actually see that particular data in that slide. I mean, it's great to like lay out lots of background things, but I mean, they're important parts. And the AUC, like area under curve, I cannot really quite make out of it. Like, are you trying to rank, like which one is the number one priority or something? Maybe a little bit more explanation will help the audience to understand. Okay, but great job, thank you.
Thank you. You want me to answer or just let's finish the time?
I'm sorry, the session says
Time's up. Sorry, but thank you very much.
Unfortunately. Thank you.